Dr. Lisa Palmer, Dr. Mama Bear, coming to you live on Parasites, Pneumonia, and Practitioners of Quantum Nutrition Testing. Parasites, Pneumonia, Practitioners of Quantum Nutrition Testing. So parasites, why are we talking about parasites? I feel like all we do is talk about parasites. Tonight is a full moon. Tonight is not only a full moon, tonight is a full moon on Flag Day. And so what's very interesting is the more I study about moons, because back in the day, I thought moons, who needs to know about moons and planets? Who needs to know about planets? My first degree was in sports medicine. And some of you guys know the story that as a freshman, I enrolled in an astronomy class, not because I wanted to learn astronomy, but because as a freshman, back in the old days where you had to dial in your classes, it was the only class I could get. And so I just had to keep it until I could add something else. So I added this astronomy class. I went to the class and I'm thinking, this is stupid. Why? What am I going to do with an astronomy class? I don't need to know about planets. I don't need to know about the moon. I don't need to know about stars. That has nothing to do with athletes or health or anything like that. And it was so wrong. And those of you that have heard us talk about parasites, you totally understand why. Hi, Michelle. Hi, Sunny. Hi, Carol. Christina says it feels like 100 in Ohio. I know Iowa felt in the hundreds. I talked to a patient earlier in the week and she said the high was 112. I got in my car to come home tonight and my temperature gauge was reading 97. So yeah, it is toasty out there, guys. So make sure you're staying hydrated. A lot of times people will lose electrolytes when they sweat. And so sea salt, not table salt, sea salt is a good electrolyte, potassium. If you're feeling tired, it might be because your electrolytes are low and you're dehydrated. So something to think about. So back to parasites, full moons have an effect on tides. Full moons have an effect on female cycles. Full moons have an effect on parasites. And so with parasites, humans can get parasites. We can eat them. We can breathe them in. I've had a patient text me today that they pulled out a large yellow parasite out of their nose. They blew out this thing out their nose. So that's pretty crazy. You can eat, say you eat raw or rare meat like sushi or a rare steak. You can get parasites from that. You can get parasites from your cats, from your dogs, from your horses, from your ferrets, from whatever. You can walk and parasites can enter your feet. It is very, very, very common and probably one of the most underdiagnosed and missed conditions of ill health in humans, right? So parasites can cause bloating, so very commonly they can cause bloating. They can cause nausea. They can cause vomiting. I've had food poisoning more than any human should have food poisoning. And looking back, knowing what I know now, I don't think it was food poisoning. I think it was parasite poisoning. I think I consumed parasites, right? Vomiting, nausea, anorexia. So some of these poor women are told that they're crazy and they're told that they have a mental condition and, they have a bad relationship with food. It's because when they eat food, they feel badly, right? And no one can find something wrong with their stomach, or no one can find something wrong with their intestines, or no one can find something wrong with their digestion. So instead of saying, hey, young lady, I don't know why you feel bad when you eat, I'm going to label you with this psychiatric condition, anorexia, and we're going to put you in a facility so you can make friends with food. Now, I'm not saying some people have interesting relationships with food. I'm not saying that. I'm definitely not making fun of anybody with eating disorders. But unfortunately, I think in a lot of times in the cases that I've handled, when someone suffers from bulimia, where they would eat and vomit after eating, or they would suffer with anorexia, it's not because they like throwing up. It's not because they like not eating, as in an anorexia case. It's because when they eat, they don't feel good. When they eat, they feel sick. When they eat, their stomach hurts. When they eat, they get nauseous. When they eat, they vomit, because that's what happens when you have parasites. So super, super common. Before full moons, they seem to get kicked up. It's like kicking the ant's nest. And these symptoms can amplify. And so if you right now, you had trouble sleeping last night and you woke up throughout the night if you feel a little anxious, if you feel bloated, if you want to go in your cupboard right now and eat the whole box of cookies, or the brownie mix is calling you, or your ice cream. Now, some of you guys are like, well, thanks. I wasn't even thinking about the cookies, but now I want them. Or the leftover stash, if anybody has leftover stashes of Halloween candy or whatever it is, right? It could be parasites. And so in our office, we do what's called quantum nutrition testing, and it allows us to check for various different causes of health problems. It allows us to look for the frequency or the energy or the pattern of different things that can be in the body. Recently, I've seen multiple cases of double pneumonia, right? So they had pneumonia in both lungs. I've had, which you would think pneumonia in the summer, like people think pneumonia like in fall, right? You guys let me know. Have you heard of anyone recently who's been diagnosed with pneumonia? I think of pneumonia as a fall type of condition or a winter type of condition. And yet we've seen lots of cases of coughing, congestion, breathing issues, and even pneumonia, right? And so what is happening? Why do some of my cases that I work on in Maine, or I work on in North Carolina, or I work in California, or I work in different places, why are they all telling me they're having breathing issues? What's going on? It's not winter, right? Pneumonia tends to be more of a cold weather thing. It's hotter than hell, right? You guys are telling me it's 103 in Louisiana. It's 100 degrees in Iowa. It's 112 degrees. It was 100 degree when I got in my car, pretty much. So it's very hot. What is going on with this lung stuff? And so if it's all over the place and it's in the summer, I would say that perhaps people are breathing it in. Well, where would they breathe it in from? Like, how could they get that? Well, it's in our air. Well, how would it get in our air, right? And so it's interesting to me. So if I take a step back and I look at it as a physician, it's interesting to me. Like, okay, where is this stuff coming from? But then if I look at it with a different type of vision, I look at it like, holy crap, why is this happening in the summertime? And so there's whole food nutrition. There's whole food nutrition that helps support the lungs. Products from Standard Process like Pneumotrophin PMGs, great lung repair supplements. Is it going to treat pneumonia? No, it doesn't treat pneumonia. But it helps to strengthen lung tissue. Just like we know that there's, a very common example is there's nutrients to strengthen nails, right? There's nutrients to boost your immune system. The medical journals would agree with that. There's nutrients to boost every part of the body. If you look at wildlife and say, a lion kills a gazelle, they're not sitting there eating the fillet. They're not sitting there eating the New York strip. They're not sitting there chewing on the muscle. What are they eating? They're eating the organs and glands. Why? Because they know that those have the most nutrition and those help repair their own bodies, right? If you think of a lion, like what a strong animal. They're not a little soy boy sitting there wondering if they want to be a cat or a dog or, a girl or a boy or whatever. They're like, I'm a freaking lion, right? And so hormonally, they are eating glands, they're eating organs because they have the highest nutrition value. What do we eat as a society? We eat meat, right? We're eating muscle. What's meat? It's muscle. It doesn't have the same nutrition as organ meats. And so some of these supplements have glands they're called glandulars. Some of these supplements have organs in them. Why? Because, grandma maybe made you liver and onions, but you hated it and you complained the whole time. Back in the day, people had, what is it called? The thymus gland. Shoot, I can't think of the name of it. Was it cheese bread, whatever. People ate glands. And so if you're not going to do it, you can have it. You can have nutritional supplements that have it in there, right? High quality nutrition supplements. So I would want to know, the cause. Like, I want to know what happened. I want to know, why are these lung cases? So Lisa's telling me she has a patient this week and was admitted 2 weeks ago with CAP, community acquired pneumonia, CAP. So I thought she was going to say CPAP or COPD. I thought she had a typo. CAP, community acquired pneumonia. What the heck is that? That's like SADS, SADS. So SAD used to stand for the standard American diet, right? or the sad American diet, right? Now they're saying sudden adult death syndrome. Sudden adult death syndrome, you mean people dying, keeling over? I'm trying to be good because I'm on the Palmer Natural Health Facebook page and I don't want to get booted off all of social media. But yeah, like, what is that? How is that a syndrome? People dropping dead, that's a syndrome? No, there's a cause to that. So Lisa's saying community-acquired pneumonia. This patient had COVID previously and was in respiratory distress on 10 liters of oxygen when he came out of ICU to her unit. So community-acquired pneumonia, I have never heard of that diagnosis before. Community-acquired pneumonia. What is that, right? So I know there's viral pneumonia and there's bacterial pneumonia, but community-acquired pneumonia. So Lisa, tell us more about that because I haven't heard that term. But that is what we're seeing. We're seeing increased pneumonia cases in the summertime, which is super weird. And these are not elderly people, right? These are people in, some of them are in their 30s, some of them are in their 40s. This is not like your 80-year-old, 90-year-old grandma. So with pneumonia, you can get parasites. There are lung flukes. You can inhale parasites. You can also eat them, cough them up, and re-inhale them, and that's how they get in the lungs. There's actually freshwater snails and crawfish that if it's not cooked properly, you digest that parasite, it irritates you, you cough it up, and you inhale it into your lungs. It's pretty freaking disgusting. Sweetbreads. Thank you, Sunny. Sweetbreads. So, people eat sweetbreads. People eat the thymus gland because it boosts the immune system. Lisa says, no, this diagnosis has been around just to differentiate between having pneumonia before coming to the hospital. Well, okay. All right. I was going to say, don't most people have pneumonia before they come to the hospital? But you're right. If you're in a filthy hospital that has superbugs in it and you hang out there, you could get pneumonia because your system is so toxic. Yeah, it's crazy. It's insane. So, if you don't believe me that parasites can get in the lungs, so some people, I have cases, they have lesions in the lungs, they have cysts in the lungs. And so a lot of times when there's a lesion or a cyst, a doctor will think that is cancerous and they want to remove that. And I would question to say, how do you know, or how do you not know? How do you know if it's a lung fluke, right? And what's the treatment for lung flukes? There's some really interesting video, actually. There's a program called The Creatures Within or something like that. And there's a case where this guy was having respiratory issues and the doctor didn't know what to do for this patient and went in exploratory surgery, which is very interesting. Exploratory surgeries, they're exploring. They don't know what to do. So they're going in there, right? And they're pulling these parasites, these visible parasites. Because remember, you have microscopic parasites that you cannot see without a microscope. And then you have big old parasites that can get feet long, right? So in this particular case, and I'll try to find the video and pop it on my Facebook page later, Instagram later. But the video is the surgeon is pulling out like slugs out of this guy's lungs. It is disgusting. It is disgusting. And so perhaps with these pneumonia cases, perhaps they inhaled a parasite that was in the air. Perhaps, they migrated into the lungs somehow. Sometimes kids with asthma or respiratory difficulties can have them. Everything has a cause, right? So I'm just, seeing, have you guys heard of this? So Lisa's saying, because of billing and reimbursement, hospitals are dinged if patients get pneumonia in the hospital. For example, if the patient is on a ventilator and gets ventilator-acquired pneumonia, this is a preventable condition and the hospital is held liable. Interesting. So how do you prevent pneumonia? How do you prevent pneumonia if someone's on a ventilator, right? Like, how do you do that? Do you give them IV antibiotics? And so I know sometimes if someone's in the hospital and they're compromised, they'll give them antibiotics. But the problem with antibiotics is that antibiotics, anti is against, biotics is bacteria. So antibiotics kill what? They kill your good bacteria and they kill your bad bacteria. And so I've had multiple cases even this week where someone was on long-term antibiotics, like 6 months, a year, multiple years, and their gut is wrecked. They can't go to the bathroom. You're supposed to poop every day. They can't poop. Their skin is bad. They're sick all the time. They don't feel good. They have no energy. There's a connection between the gut and the brain. they're depressed, right? So the gut's not working properly. They're not going to be in a great mood. I have never had a patient come in and be like, my stomach feels horrible. Yay. Like I've never seen a patient that doesn't like a patient that feels poorly. I have never seen them come in a good mood, right? They're usually grumpy. They're irritable. So I tell my staff, hey, if someone comes in, they're super grumpy, just kind of give them grace because they don't feel good. Now, if they continue to be grumpy throughout their treatment, then maybe they're just grumpy. But typically, if someone's grumpy or irritable, it's because something in their system isn't working well. Something in their system is not right, and we have to find out why. Okay, yeah, you're welcome. Hi, Jeanette. Hi, Jenny. Hi, Joanna. Very cool. So if someone has potential parasites and they have nausea and they have vomiting and they have bloating and they have gas and they have, different digestive diagnoses. So sometimes a patient will come in with a diagnosis of ulcerative colitis, or they'll come in with a diagnosis of irritable bowel syndrome, or they'll come in with a diagnosis of diverticulitis or diverticulosis, right? Something irritated their digestive tract. Their body just didn't say, today I think I'm going to have, I'm just going to have diarrhea for fun. Like their body did not say that. Or, hey, I just decided that when you poop today, we're going to go ahead and put mucus and blood in it just, as a decoration. Or their body didn't say, in the intestines, we're going to make these little pouches because that seems like a good idea, right? The body didn't do this. The body didn't have symptoms just to have symptoms. The body had symptoms for a cause, and oftentimes it's parasites, oftentimes it's bugs. And there's handlings for it, right? There's handlings. There's liquid supplementation that can be given, stuff like this, like Para 3. Liquid, easy to take, easy to handle. And with the quantum nutrition testing, so the fun thing is I've been teaching practitioners of all different types, doctors of chiropractic, doctors of oriental medicine, medical doctors, nurses, nurse practitioners, massage therapists, yoga instructors, health coaches, elementary school teachers, stay-at-home, whoever wants to learn. I don't care what your credentials are, because I know that if you're passionate about this work, that we will figure out how to get you to do it to help other people, right? And right now, our planet needs some help. Right now, the people of our planet need major, major help. And so however I can help move that in the right direction and help our kids, I'm extremely concerned. I was watching a documentary, and I think the stat is like 1 in 2 kids will be obese. 1 in 2 kids. 1 in 2 kids will be obese. And we know obesity leads to diabetes. And we know obesity leads to heart conditions. And we know obesity can lead to cancer, right? And so, we're gonna train practitioners. If you're interested, I'll put the link in the comments. We're gonna train people to use this technology called quantum nutrition testing to find the cause of people's problems. Maybe it's parasitic. Maybe it's a chemical toxicity. Maybe the person was damaged by something. Maybe there was mold in their house. So I've worked on, some Florida cases. In other cases, the person has mold. The worst mold case I ever heard of, a lady had a mushroom growing out her living room. That's a major mold. That's a major moisture. The body doesn't like that at all, right? Maybe they're toxic with radiation. So there's many, many causes. And we use this technology to locate the cause. And instead of cutting the cause or suppressing the cause with a medication or ignoring the cause, we look for the exact right supplementation, not to cure it and not to treat it or not to diagnose it, but to give the body the nutrients, to give the body the vitamins, to give the body the minerals that the body needs, because we were innately created, right, to heal ourselves, that the body needs to heal itself from whatever the cause is. And then, of course, we're going to locate the cause. So if it's mold and someone is not aware that they have mold in their house, a lot of times people are aware, they'll tell me like, oh yeah, my roof is leaking, or yeah, the basement's really wet, or yeah, we had this shower leak or whatever. We're going to find the cause. We're going to help them handle the cause. And when we handle the cause, the person improves their health. And with improved health, your symptoms go away. With improved health, diseases go away. With improved health, conditions go away. With improved health, labels go away, right? And so that's what's super fun. If you want to join our team, if you want to learn more about quantum nutrition, super happy to help. If you know someone who is suffering and they need our help, super happy to help. Looking for the cause. Now they have to want to get better. Sometimes there's people that are like, well, have this friend, but they really don't want to get better. They really don't want to change anything. I don't want that case. If they aren't willing to make improvements in their life, some people like their label. They like to say and they like to complain that they have this disease, and they like the attention that this label gives them, and they like the attention that they get to talk about their disease all the time. If that's the person, then I can't help them, and probably you can't help them until they decide to change their mind. I was talking about earlier to a group of amazing practitioners. If you have a friend and they're drowning and you stick out your hand, which you're not supposed to do, by the way, to a drowning person, you're supposed to throw them something because they can pull you in too. But just say like you stuck out a life raft to them and they knocked the life raft away and they said they didn't want it. Can you help the person? No, you can't help that person. If they're not willing to help themselves, you can't help them. You can talk to them. You can try to educate them. You can try to be there for them. You can try to do all these things. But if they're not willing to make the change, if they're not willing to get better, they're never going to get better. And I know that sounds harsh and it sounds mean, but it's true. Now, on the other hand, if someone wants to get better and they want their kid to get better and they want themselves to get better, then absolutely the body has an amazing potential to heal. If you cut your finger, you don't tell your finger, okay, bring some clotting factor there to clot up my blood, and then go ahead and I think you need to put down like 15 skin cells. And I think that you don't do that. Could you imagine if we had to do that? That would be exhausting. Instead, your body has this innate ability to heal itself, which is great, because I can't even imagine if I had to tell my body to do all that, like verbally. Could you imagine if you had to tell your body, okay, inhale, good, exhale, good, chew, good, move mouth to talk, good, move tongue to make words. Like, oh my gosh, that would be crazy. All right, so Jeanette's asking, how can we have our home tested for mold? If you are currently working with us, there are ways of doing that. They're very inexpensive. One of our favorite ways is to collect an air sample in a mason jar. So you take a mason jar, you clean it with soap and water, you open up the mason jar, you leave it in the room that could have mold. The air will circulate into that jar. We cap the jar and we can test that jar to see. There's other more advanced ways called an ERMI test, where a specific company will come in and they will take dust samples, they will take drywall samples, they might take carpet samples, and they run those in the lab and they see if there's any mold particles. So there's multiple ways of doing that. And another way is if we're testing the person and we're finding mold on them, is it old mold? Was the mold something that you ate, like with the moldy leftovers or moldy bread? Is the mold something that you drank? Is the mold something that you were exposed to? So those are all things that we can test for to see what is the cause. Is it mold? Do you need to handle it? Now here in Florida, it's super moist, right? It's really humid. It's really moist. There's mold particles in the air. Okay, so your body should be able to tolerate mold. It should be able to tolerate chemicals to a certain extent. It should be able to tolerate the heat. It should be able to tolerate its environment. If the body cannot tolerate certain factors, like if you go outside and you're like, oh my gosh, I feel like I'm going to pass out. It is so hot. Your thyroid gland, which is like your thermostat, your thyroid gland may not be working right. Like if you're like super, super cold, like your feet are ice cold and you're like, put them on your husband and he's like, your feet are freezing or your hands are freezing, or you're the opposite and you're like sweating, it could be your thyroid's not working right. Your thyroid blood work could be perfect, but it doesn't mean it's perfect for you. So then there's whole food supplementation and there's herbs and there's carbon technology that we could use to help rebalance your body so your whole body works better. Very cool. All right, so Lisa is coming to our level 2 quantum nutrition testing class in October. That's amazing. Alice says, my mom won't get better. She loves her labels and taking as many drugs as Walgreens has. Oh my gosh. Yeah, so that happens. That, some people like the attention. Oftentimes when older people get together, they like to talk about their doctor's appointments and their health conditions and their diseases and all that. And so I would encourage you, if you have a family member and they're open to changing, that perhaps, you encourage them to volunteer at their, at anywhere, at a camp, at a local animal shelter, at a homeless shelter, do anything. The problem is our elderly retires, right? Our older generation retires, and then they don't have a game. They don't have a purpose. They're like, well, I worked my whole entire life so I can retire and live my life. No, live your life now. And then if you're in retirement, good, all those things you want to do while you're working, do that. Learn the piano. Spend more time with your grandkids. Help our planet. Help learn quantum nutrition testing, right? My mom was a nurse for over 40 years in a public hospital, right? She had worked multiple different departments. She worked in dermatology, so skin. She worked in radiology, so x-rays. She worked in immunocompromised, so she worked with AIDS patients. She worked in breast health. That's self-explanatory. She worked in an emergency department, emergency medicine. So she worked in various different things. And when she retired from nursing, because she was at the end of her career, she did home health, which is very challenging. I said, Mom, you've always been interested in natural health care. Why don't you learn more about natural health care and come work with me? So in her 70s, she worked full time with me and had patients and loved it. And truly, I'm speaking for her, and she can comment if she's on, but she truly felt like she was living her purpose. She truly felt like she was helping patients. Now, she would still be working with me to this day, but she retired, if you will, to help my father after his stroke. But yeah, who says, learn a different career, learn a different instrument, do art, do whatever, but keep moving forward. Michelle says, clean out your coffee maker and filter contraption. Also, water bottle lids with rubber seals. Yes. I have seen disgusting things in toys, like tub toys. So I was reading something. Leah had those like little rubber duckies. And then you kind of see that the bottom of the rubber ducky is changing color. And one day I squeezed the water and like pieces of mold came out. And I'm like, oh my gosh, these rubber duckies are disgusting. So water toys for the bathtub for little kids, for the pool. One of the grossest things I ever saw is kind of like what Sunny's saying, or Michelle's saying, is I had a patient had a water bottle and she kept showing for bacteria and we couldn't figure out why. And I looked at her water bottle and I'm like, how often do you drink out of them? She's like, yeah, every day. And I go, well, how much water do you? Oh, I drink multiple bottles. I'm like, oh, that's great. I go, do you fill it up at work? Yep. I go, okay. So then how often do you wash it? And she kind of got a little uncomfortable. And it turns out she didn't wash it very often. And so she would drink out of it. And then remember, if you're drinking out of something like a cup, right? The water slides forward in your mouth and whatever you don't seal slides back in the cup. So as adults, we're pretty good at not getting backwash into our cup. But if you've ever shared a cup or a water bottle with a little kid, you see all these particles come out, which is really disgusting, right? So to a certain extent, whether it's a water bottle or a straw or whatever cup, bacteria from your mouth is going back into that vessel. If you do not clean the water bottle, the coffee cup, the whatever it is, mold's going to get in there, especially the ones with the straws. Like you got to clean the straw with the little straw brush. And so this patient, she was just refilling her water bottle at work and, figured, well, it's water. Why would I need to wash my water bottle? And she brought her water bottle in, and then the bottom of the water bottle was black mold. It was disgusting. It was really bad. So yeah, you can get sick with that. Totally. Alice says she vomits all the time when she tries to eat solid food. She was in an abuse marriage for 21 years. I'm sure that has helped this form. Yeah. So I've had cases where they eat. Actually, one of the craziest cases is I had a patient who I found parasites on, and her stomach wasn't good, but she didn't say anything about vomiting. And I had found such a heavy parasitic load on her that I was like, by any chance, do you vomit at all? And she's like, yeah, very nonchalantly. And I'm like, okay, well, how often? And I'm thinking like maybe once a month or something. She goes, yeah, every meal. I'm like, excuse me? She's like, yeah, every meal I eat and then I throw it up. And then, I go, do you throw up on purpose? No, it just comes up. And I'm like, oh gosh, oh, that's not good. And so she would eat and she knew she'd throw up, and then she would eat, her lunch and throw that up, and eat her dinner and throw that up. And the poor lady threw up so frequently that it became normal for her, just like they're trying to normalize people dropping dead, which is not normal. It should not be normal for someone to drop dead in front of you. That is very not normal. And we handled her parasites with natural herbs. And as we handled her parasites, she could then begin to eat for the first time in a decade without vomiting. And so at the end of her case, she wasn't vomiting anymore. She was doing super good, and she was a success. Jeanette's asking, does quantum testing determine, prioritize what health issues need to be addressed, if need to have mercury fillings removed, address mold, parasites, Lyme, Epstein-Barr virus? Yes, Jeanette. So through the testing, it's a very respectful technology in that we don't do 20 million things all at the same time. So, as a physician, as I'm taking the history, I'm taking the information for the patient, I might think, okay, well, this person's going to have to detox metals, or this person definitely has parasites, or this person has whatever. And then I kind of compartmentalize that thought, and I do the quantum nutrition testing, which is based on muscle testing. And I find whatever I find, right? So sometimes, like we talked about bad acne cases, sometimes the acne could be from parasites, or the acne could be from a destroyed gut, and I can't work on the parasites first. The body is like pleading, please restore the gut function, right? So put good probiotics in the body. Sometimes all I can do is just get the person pooping. I can't kill parasites because the person doesn't poop. And if I kill parasites and they're not pooping, they're going to feel horrible. And so through the technology, we're able to determine, what project do we work on first with the patient's agreement, right? What project do we work on first? And then as they get better, it's almost like stripping down old wallpaper. So, okay, all right, this wall has polka dots. All right, good. So let's pull that wallpaper down. Oh my gosh, now there are little flowers. Okay, let's pull that down. Oh, it's pinstripes. Same thing with healing. So the body will say, please work on this. And as that's getting better, then it might say, okay, let's do a heavy metal detox. Okay, good. Now let's work on mold. Okay, good. Now let's work on parasites. And so when patients say you have to do this detox first, or they like demand what I do first, I'm like, look, I would love to help you with that, but we have to get you pooping first, or we have to fix your gut first, or you're so exhausted, we have to help the body repair the little tiny mitochondria in your cell so you actually have energy to get out of bed in the morning. That's what we actually have to handle first. So pretty cool. Lady Cat is saying that the refrigerator water hose can get really nasty. Yes. So I've had a whole family sick from where, you take your glass and you have the water dispenser. I don't know people that switch out their filters on that. Your refrigerator water has a filter. You're supposed to change it. Most people don't. And then the tubing to the water, a lot of times it gets clogged and it has mold and bacteria and nasty stuff. So just things to check if you're not feeling well. That patient's tooth enamel, yeah, her teeth were wrecked because she vomited so frequently. What about mold from breast implants? I've been working with Renee. She's not mentioned it, but I've probably got mold there. Yeah. So breast implants, ladies, don't shoot the messenger. Breast implants are not healthy for you, right? The plastic leaks. If it's silicone, it leaks. And I don't mean leak like it gets a hole and it leaks like the fluid. I mean that the actual bag that contains the silicone, or the bag that contains the saline water, your body will break down the plastic. How do I know? I had a patient who was a nurse at Mayo Clinic, and he did breast explant removal. So when you have an implant, in is in, all right, they put it in, explant, X out. They take it out, explant. And so he's like, I know for a fact that it breaks down in the body. I'm like, well, how do you know? And he goes, well, we've done explant surgery where we go to take the implants out, the implant out, and it just like dissolves. It's just like soup, right? And so when you put plastic, so think about if you were to, I don't know, go to the beach, and your kid had sand toys and they got all wet, and then you sealed the top of the sand bucket, like the wet bucket, and there was water in there. What's it eventually going to happen to that water? It's going to get moldy. So an implant can be, I don't want to say all times, but it is very likely that implants will have mold around them. Does that mean every single woman that we work on that has implants needs them removed? No. Does that mean every single person that has root canals in their teeth, in their mouth, it all has to be ripped out? No, it doesn't mean that. But if a person's health is compromised and they're getting stuck at a certain level, then we have to look at other things that can be contributing to it. So do you need to get the implants removed? Do you want to get the implants removed? Is it something that's holding up your progression of your health? If someone has cancer or something really bad, then we're going to dig as deep as we need to dig to get their body moving in a healthy way. To see women's bodies change after implants. I mean, I've seen friends where, I told them, like, please don't do this. This is not a good idea. And they're like, well, you don't understand. You have boobs and I don't, and I want them. I'm like, okay, but this is what I see in the offices. I see women who cry that they wish they had never, ever, ever got implants because they have brain fog, they have headaches, they have migraines, they have acne. I've seen a lot of implant cases with acne. They have hormonal issues. They gain weight. They feel bloated. They feel crazy. They feel, like all this list of symptoms. So is it something that needs to be handled? Don't know. Can it be handled? Yep. Do they grow mold around them? Yep. Have I seen gross stuff with it? Yes. Lisa says plastic is porous, so over time, it's only logical that it would leak. Yep. So it leaks both in that the body breaks down the plastic, and then the body absorbs those toxins. Okay, good. No root canals, no silver amalgam mercury fillings. Tooth implants could be zirconia and not titanium. Yep, that's true. At least you're funny. Okay, so that's what I want to tell you guys. If you need our help at the office, if you know someone, whether they're in Florida or somewhere else, and they're suffering and they feel like no one can figure them out, we're very good at cases like that. If you are suffering and we're not currently helping you, if we are currently helping you, please call so we fix it. But if we're not currently helping you, then please reach out to us so we can help. If you are interested in natural health care and it's always been a side hobby, amazing to you, you love the world, then maybe you want to take the quantum nutrition class. I'm Dr. Lisa Palmer. Thank you guys so much for joining me tonight. Enjoy the full moon. Don't feed your parasites. Good night.